Hello, welcome to another segment of In Medicare News. Today's news article, today is April 3rd, 2018. Today's news article comes from, I saw it in several places, but the one I'm going to call out is CNN Money on April 2nd, 2018, and the headline is, I'll make sure it's up there on, I'll make sure it's a clickable link for you. The Trump administration aims to lower drug prices for seniors. And I actually had this one sent to me as an alert because I actually didn't see any real anyone covering this in any kind of media, so I wanted to bring this out. I thought it was kind of interesting, and I'll kind of go over the highlights of it. It looks like a series of about 3 different regulations, 2 things that they just went ahead and did, and 1 thing that they're seeking comments from stakeholders for to see if they're going to do it. And it's all mostly good news for you. Turn the microphone here a little bit. Let's see. So the first thing, the Centers for Medicare and Medicaid Services, that's CMS, the group that governs Medicare, that regulates Medicare, said Monday it will allow insurers to include certain low-cost generic drugs in their approved lists at any point in the year. And I want to stop there for a second to explain that. Basically, when you sign into either an Advantage plan or a prescription drug plan, they're going to give you a list, and that list can change under certain circumstances during the year, but it's really hard to add or remove a drug unless there's something really significant going on. Usually, it doesn't. You can't add another drug to a list in most cases until the end of the year when they put out a brand new list. The list is called a formulary. Well, Medicare is going to make it so that if it's a low-cost generic drug, the prescription drug plans will be able to add those drugs with a greater amount of ease in the middle of the year. Now, this article does not actually specify what a certain low-cost generic drug is, and it also doesn't specify what happens to the more expensive either brand or generic drug that it may be replacing or it may be superseding. But that is good news for people because right now if a lower cost drug comes in and the plan did not cover it, it's really hard to get them to cover it in the middle of the year. So this is good for people. The article then continues, also the agency hopes to broaden beneficiaries' choice of where they get their medications by clarifying that insurers must give all interested pharmacies an opportunity to participate in their networks. Now that's very important. Plans are really good at getting national chain pharmacies in their networks. Usually, if you're a big name pharmacy or a place that sells prescription drugs, you are a part of almost every prescription drug plan and Medicare Advantage plan's prescription drug network. The smaller pharmacies, the mom and pops, the local places, the regional places, they sometimes have a little bit harder time getting favorable terms to become part of a prescription plan's network. So this is going to actually open it up so that you may have more choice of where you go to pick up your prescriptions. So that's kind of a really good thing if that actually happens, if that goes through, because not everybody really wants to go to the big box store to get their prescriptions while they're out shopping for a new pair of underwear. The next thing that they say is CMS will also reduce the maximum amount that low-income beneficiaries have to pay for certain medicines known as biosimilars. That's a Medicaid issue. That's not going to affect too many people that have choices. Then the interesting part that I read here, to increase competition and choice, the agency said it will lift the regulation that limits the variety of Medicare Advantage plans an insurer can offer in a county. What makes that interesting? is that, first of all, I don't know if this is a response to the issues that are going on with the Affordable Care Act, or this is a part of a long-standing issue with Medicare Advantage. There's a lot of choice in a lot of counties, at least in the states that I service. There's a lot of choice. Now, there's not a lot of choice with Affordable Care Act plans, which isn't, my business. It's not what this is. But in a lot of counties in the state of Ohio, if you have to get your insurance through the exchange or the marketplace, whatever you want to call it, there's one plan. That doesn't actually mean there's only one plan available. That just means there's only one plan on the marketplace. It's a little deceptive how that is reported. Excuse me, deceptive isn't the right word. It's not reported as properly as it should be, because if you don't need to get your health insurance through the marketplace, you actually did have other choices. But Medicare Advantage, there's a fair amount of choices in many counties in all the states that I service. Now, some areas do a whole lot better than others. If you live in the state of Ohio, if you live in Cleveland, or if you live in Youngstown or Akron, you get a heck of a lot of choice. That is a lot different from my home county, which is in the Mansfield area. There isn't as many choices by a lot. So what they're saying to increase competition and choice, I don't know if that means that they want to mean there's going to be more counties available in places like where I live or what. But that being said, I do work in every county in this state and most of the counties around us. The counties where there's a great deal of choice, there's a lot of confusion as it is. So, like, in one county in particular, there's almost 40 choices of plans versus, I think, the 6 or 7 in my county. Even 6 or 7, there's a great deal of confusion, but when you get up to 40 different choices just for Medicare Advantage, and it doesn't even discuss that's not even to open up the question of what happens with the Medicare supplement, which opens up a whole bunch of other choices too. There's a lot of choice. Are we going to go from 40 choices now to 50 choices? While it's great that there's going to be more competition, the thing is, you guys are going to be the ones that are going to be selecting a plan, and if every plan is going to start advertising to you, and you're already tired of the level of advertising you get in your box, that's going to be a lot of stuff. You're going to really need someone to help sort that stuff out for you. So make sure you talk to somebody who understands these plans before you actually, get your plan. The last thing on this news article, there's a lot. Apparently Medicare did a whole lot of things yesterday towards the end of the day. CMS also announced yesterday that it will increase payments to insurers offering Medicare Advantage plans by an average of 3.4% next year, which will allow them to offer more supplemental benefits such as handrails, shower chairs, and other devices that assist the elderly. Previously, these supplemental benefits were limited to health-related items such as gym memberships or eyeglasses. There's two parts to that. The first is by increasing the amount of payments to insurers offering Medicare Advantage. That should, we won't know for sure until we get closer to October, but that should mean that you're going to get lower increases in your copays next year, which is good. So that part is good. If you're a Medicare Advantage fan, if you're in Medicare Advantage, if you're looking at it, that probably means that you're not going to see as high of a bump in your copays. We hope, that's the theory, than you would if they did not increase that average copayment increase by what they were planning to. Now, the other thing, though, I've talked about this in my Q&A videos. They're going to allow more supplemental benefits. Don't buy insurance for the supplemental benefits, really. I think it's great if you already have the insurance, or you're looking at that one and comparing the medical benefits to other things, but don't buy health insurance for the benefit of getting a shower chair. I mean, really. That goes along with the advice, don't buy your health insurance for the benefit of getting a gym membership. You really want your health insurance to help you when you need health insurance. You don't need it for a free benefit, because you can't change these things in the middle of the year. And the type of insurance, like a Medicare supplement, you could change in the middle of the year. You don't really want to try to change that when you actually need the health insurance, because there's a good chance you can't. So really, it's great that they're going to offer it. They may offer a few other things, but please be smart when choosing health insurance. If they do wind up offering you more health benefits, you need health insurance for health care, for major medical services. Even if you're in perfect health now, you really need it to if something happens and your health changes in the middle of the year. Don't pick it's great if they're doing it, but don't choose health insurance because you're going to get a shower chair. That's all. I'm going to be sure to link this in the description, this article, and please subscribe to my channel. And I will make sure that as more Medicare news comes up, I will update this playlist with the latest information. Please be sure to share it, and thank you very much.